Shelby Lyons. Miranda is videoing me, and Shelby is evaluating. So my doctor has put in orders for me to give Jamie Wheeler some morning medication. So that's what I'm going to look over. It looks like we are going to be giving digoxin, 250 micrograms PO, and we're only going to be giving that to her if her heart rate is over 60. So if it's less than 60, we're not going to be giving it. We're also going to be giving vitamin B12, 1,000 micrograms IM. We're going to be giving that in her deltoid. And we're also going to be giving Levemir, which is insulin, 10 units, and we're going to be giving that subcut in her abdomen. I'm also going to check our MAR to make sure that each of these orders were put in correctly. So digoxin, 250 micrograms PO, vitamin B12, 1,000 micrograms IM, Levemir, 10 units subcut, and we're all going to be giving these at 0800. I'm also going to look at Miss Wheeler's chart in general. It looks like she has an allergy to codeine. Codeine won't affect any of these drugs. We also have some lab data from her, and so we are also going to look at that and see if that will affect any of these medications. She has a heart rate of 79 right now, so we are going to be giving that digoxin, so we won't hold back from that. And her blood glucose is 132, so we are still going to be giving her some insulin since she's not hypoglycemic. She also has a history of CHF, type 2 diabetes, and she has also had a surgery in the past 6 years. So we're going to go to the supply room and get some stuff. So we're in the supply room. My insulin has to be pulled here, so I'm going to get my gloves on and pull some Levemir. Grab some alcohol. Okay. I'm in the supply room. It is 7:50 right now, so we're going to be giving these meds on time today. I wasn't given any labels today, but I would usually label my medications. So for this, I would say that this is Levemir, 10 units, and what patient we're giving this to. So I'm going to put 10 units of air in here. Boom. And we're going to put this in here. Inject our air. And then pull back 10 units. We're going to make sure no air is in there. And once we have 10 units with no air, I can go ahead and pull my needle out. And I'm going to recap this needle since it is still clean with one hand. This is when I would label it, and I would also have a second RN come in and check to make sure that this is actually 10 units of Levemir and that we are giving this to the right patient and for the right reasons. Now that we have that, I'm just going to recheck our MAR to make sure that we have 10 units of Levemir in the correct gauge needle. I'm going to go ahead and pull our vitamin B12 and our digoxin. I've already done the calculations for this, so we are going to be giving, let me just hold that under there. Okay. So next I'll grab our digoxin. So this is in a 0.25 milligram tablet. I did our conversion, so one tablet is 250 micrograms. So I'm going to grab some stuff here for Miss Wheeler to be able to take this safely. She has a regular diet, so taking PO tablets is just fine. We're going to grab vitamin B12. We're giving this in her deltoid. So we're going to grab a 1 to 3 ml syringe and also a 25 gauge needle that is 5/8. This one is open, so I'm gonna grab this one and I guess put this in the sharps. Okay. Also, none of these medications are expired. So right now at 7:55, we have all our right medications when compared to the MAR, and I'm giving these to Miss Wheeler. And yeah, we're gonna go back to bedside now. Okay. Hi, Miss Wheeler. My name is Carly. I'm going to be your student nurse today. Can I have your full name and date of birth? Okay. So I know you have an allergy to codeine, so that shouldn't affect what I'm going to be doing today. Your doctor has put in for some morning medications for me to give to you. We have digoxin, 250 micrograms that you're going to be taking by mouth. We have vitamin B12, 1,000 micrograms IM, which is an injection that we're going to be putting into your arm. And we also have Levemir, which is your insulin for your diabetes, 10 units that we're going to be putting subcut into your abdomen. I would usually have labels for all of this, but we weren't provided anything to make sure that everything was labeled correctly. We're going to start with your digoxin. This is for your congestive heart failure for some of your symptoms. Let me read off a few side effects. So if you experience any of these, you can just let me know. Some side effects of your digoxin is nausea, vomiting, diarrhea, headache, dizziness, weakness, or possible vision changes. Alright, I have Miss Wheeler here. It is 8 o'clock in the morning. We are going to be giving digoxin, and we are going to be giving 0.2 milligrams, which is equivalent to 250 micrograms, and we are going to be giving this by mouth. Okay, Miss Wheeler, this is your digoxin. Okay. So next we're going to be giving your Levemir. This is 10 units of Levemir. And we are going to be giving this at 0800, subcut into your abdomen, and I still have Miss Wheeler here. Some side effects that you may see from Levemir is irritation at the injection site, possible hypoglycemia, weakness, or cramps. Before I give Levemir, I would want to check her blood glucose to make sure she isn't actually hypoglycemic. And I would also want to assess for any physical symptoms of hypoglycemia, and she is not presenting with any, and her blood glucose was 132, so it is okay to still give her Levemir. Since we're going to lift her gown up, I would provide privacy and make sure that she is comfortable before just pulling her gown up and exposing her. We don't have a little pad here, so I'm just gonna pretend to inject this. So we would wipe and let that air dry. I'm going to pretend it's air dried now. Going to expose my needle. I would pinch the fatty tissue here and inject the Levemir. I would push it in, and I would continue to pinch her fatty tissue. Once I've injected it, I would hold it for 10 seconds and pull out our needle and let go of her skin. And I would immediately go put this into the sharps container. Throw that away. Gown back down. She tolerated that well. Okay, Miss Wheeler, the last thing we have is your vitamin B12, which we are going to be giving IM in her deltoid. We are giving 1 milliliter, and we have vitamin B12, and I still have Miss Wheeler here. And we are giving this at about 8:05 now. So I'm going to pull 1 ml of air, and then I would push this into our vitamin B12, inject our air. Then when I come back, I would pull back 1 ml of air. I'm going to push any air bubbles that I have out. Looks like this one doesn't have any, so I'm going to pull out our needle. And I'm going to do the scoop method here. And recap that, since this needle is still considered clean and unused. Put that away. Now I'm going to change our needle, since that needle can be dull and actually hurt Miss Wheeler. So I'm going to undo this one and put on our new needle. I'm going to put this in our sharps container. Okay. Okay, Miss Wheeler, I have your vitamin B12. Some side effects that you can experience from this is increased blood pressure, dizziness, headache, cold symptoms, rash, or anxiety, or irritation to the injection site. This is a daily vitamin. So some landmarks that I would feel is I would feel for her arachnoid process here, and once I feel that, it's like the two bones that come together. I would go 3 fingers down and then make kind of an invisible triangle, and then go in the triangle in the middle of it, so it'd be right here. She has kind of the crusty arm, so I'm gonna wipe that away. I don't know what's on there. Okay. So I am going to undo our needle. I'm going to do the Z-track method. And I'm going to go in between, in the middle of our triangle. I'm going to push in our medication, still holding the Z-track. Once I have injected it, I'm going to hold it for another 10 seconds. I will pull out our needle and release the Z-track. I'm going to activate the safety device, and then I'm going to immediately go put this in the sharps container. I'm going to doff my gloves and perform hand hygiene. I'm going to reassess Miss Wheeler to make sure that she isn't experiencing any immediate reactions to the medications I've given her. I'm going to make sure that she is in the lowest position possible. She is in a state of comfort. I'm going to leave her with a call light. I'm I'm gonna give her her bedside table, and then Miss Wheeler, I'm gonna come and see you in about 15 minutes to make sure that you're still doing okay. And I am going to leave our room. And once I have left, I am going to document what I have done. So I have pulled up our MAR again. I'm going to make our key down here. So the first thing we gave was her digoxin at 0800. Her heart rate was above 60, to be exact. It was 79, so I'm going to enter that. So it was still okay to give that. We gave it PO. Today is the 24th. An initial that was me. We gave vitamin B12 in her right deltoid at 0800. Today's date is the 24th. Going to initial there. And the same thing with her Levemir. We gave that subcut in her right lower abdomen at 0800, and we gave that 10 unit subcut in the right abdomen. And then I'm going to go put these medications back in our supply room, and that would be it.